So for trach care sectioning, make sure you gather the proper supplies. First things first, you want sterile water, and you want to make sure you grab the suction catheter tray for the sectioning supplies. So prior to sectioning, you want to make sure that you position your patient up to at least 30 degrees, if not contraindicated. You want to make sure that you have them on continuous pulse ox at all times so you can monitor their oxygen saturation. You want to make sure you turn on your suction source to continuous 80 to 120. You want to make sure that your patient is hyperoxygenated, so you want to make sure you increase the FiO2 to 100%, and you will increase the oxygen based on how much the guideline says. So for this, it's 12 liters per minute, so we'll turn that on to 12.
Okay.
So before you start sectioning, make sure you do hand hygiene, and you want to pre-open your supplies. So starting with the suction tray, you want to open it always away from you to keep the area sterile. You want to grab the gloves, making sure you don't touch anything inside that is sterile, and put it off to the side to be ready when you put it on. And you want to unscrew the top of your sterile water, but do not take the cap off until you're ready. Okay. So now you're ready to put on your sterile gloves so that you can work on your sterile field. So open the gloves and make sure you don't contaminate any part of the glove. You will pick up the glove that is for your dominant hand first and place it on. And you will take your second glove. Okay, so now that you're sterile, you can reach into your sterile field. Okay, depending on how you like to do it, it's up to you. I like to coil my suction so that way it's easier for me to access. Okay, now at this point, you will grab your sterile water, take off the cap. Notice how I've already contaminated this hand, so this is considered my clean hand. You'll take off the cap, pour water into your sterile field. You will go over to your patient, remove them from their oxygen source, but make sure you have it misting over your patient just in case anytime your patient desaturates, you have easy access to it. You will take your suction source, attach it on, and remember, now the 1 inch closest is now considered dirty, so you don't want to touch it. And before you suction your patient, you want to make sure you prime your line and ensure that your suction is working. So ensure that when you're ready to suction that you do not apply suction going in, only coming out, okay? You will go in and make sure you don't touch any parts of the outer cannula, only going straight in. So go in until you meet resistance. Once you meet resistance, you're going to pull back, and at this point you will continue to apply either continuous suction or intermittent, going in a circular motion. And as you're withdrawing the catheter, you ensure that you are not contaminating any parts, and we don't suction for longer than 10 to 15 seconds. If your patient needs additional suctioning, ensure that you do not go for more than 3 suction passes at a time. If your patient needs to be hyperoxygenated in between each suction pass, ensure that you connect them back to their oxygen source and wait at least 30 to 60 seconds before you proceed. Once your patient is done, ensure that you wrap this into your glove and dispose of it in the biohazard, okay? Turn your FiO2 status back to whatever the normal settings were and whatever it matches to your oxygen source.